Welcome to Conversations with Melissa, part of RenaFi's Experts and Influencer series. RenaFi provides practical, research-based advice, courses, and peer support, and focuses on the underlying drivers of our ADHD behavior. Through courses like budgeting for the ADHDer, home organizing for the ADHD lifestyle, and of course, our ADHD book club, to name just a few, we provide a holistic program that serves to help you thrive with ADHD, not in spite of it. Follow our YouTube channel for ADHD resources and information, and visit us at renafi.com to learn what we have to offer. Okie doke. Thank you so much, RenaFi. All right, and then thank you so much to our guests here, Dr. Bill Dodson and Beth Bardeen. So today we're going to do RSD from two perspectives. We have Dr. William Dodson, the clinician, what RSD looks like from the outside in. Dr. Dodson is a board-certified adult psychiatrist who does not have ADHD. He has worked with his adult ADHD patients for the last 25 years to understand and document rejection sensitivity dysphoria. Dr. Dodson has been on the forefront of diagnostic and treatment reform for ADHD and rejection sensitivity dysphoria. He is now retired from clinical practice and resides in Colorado. Beth Bardeen, the RSD survivor, what RSD feels like from the inside out. Beth is an adult diagnosed with ADHD after a 30-year career in the Seattle tech industry, specializing in marketing and organizational behavior. Now Beth researches rejection sensitivity dysphoria and is an advocate for the newly diagnosed, with a focus on explaining the internal experience of RSD. She lives in Seattle and is the founder of the Seattle chapter of CHAD. All right, thank you both for being here. And
Melissa, thank you.
I'm just going to step out of the way. I'm going to take the focus off me and let you have at it and interrupt you every so often.
Sure. And thank you, Rick and RenaFi too. This is, we love this opportunity, really appreciate it. I think this is where we were. So one of the things that I kind of came on to quickly is, why is it that I don't get triggered? Like, I was in one relationship and that was more like a long-term member of the family. It just, when you marry a good friend, it may not ever have, that romantic feeling. So I never felt rejected. I never had that response. But in my second marriage, that emotional connection was different. And I was getting triggered all the time. And I'm like, why in one and not the other? And it isn't that my first marriage didn't matter to me. It did. It mattered to me differently. Right. So, and can even be like the customer service agent that isn't helping you get into your bank account that you need to get into, and they are rejecting and stopping you from what you need to do. You may not have a full-blown response, but you're still having that feeling. When I started getting treatment, I noticed little things like when my password was rejected, I was no longer having a visceral response. And I thought, okay. I never would have mentioned it to anybody before, but it was something that I noticed as I started treatment. So the one thing I'm not always going to read the slides. I think people are okay with that. But the last line is so important. And those that care about us, they have to understand these nuances. And because it isn't binary. It isn't if they do one thing one time and not the other, or, I mean, and typically because they do care about us, they want to understand. It takes them as long to understand it as it does us. So I created this slide early on in my RSD journey because I needed to know how long it was going to last. It just, every time, it could be 20 minutes, it could be 40 minutes, but it still felt like an eternity. And so this understanding for me what my phases are of my episodes, it helped me know where I was as it was passing, because then I could know that it was going to end soon. And so for me, the water drop is where the water drop hits the water and the surface tension pulls it down. That is the impact of the trigger, and that black hole, that another dimension where it's like pulling you down. And then as that passes, then you have your reaction. And for me, it kind of depends on whether or not somebody is chiding me, or are they supporting me. If they're chiding me, I'm going to get angry. And if they're being supportive, then I feel shame because I don't deserve that. And then I start climbing out, and then I got to get away. And I think that is that release where it's like, I've got to leave the house. I've got to go run into my room. I've got to go down into a conference room. I just got to get away. And as I'm getting away and I'm breathing and I'm thinking about it, I start to reflect, what was my part? Did I overreact? Why would they do that? And eventually the reflection fades. But I don't think, if it's severe enough, I don't think it ever really goes away. I have fading ripples from when I was 4 years old that are still there. My mood doesn't change. I just can still feel it viscerally. Okay. Has anybody ever thought themselves or been told that they're a perfectionist or an overachiever or a people pleaser? And the thing is that if you are perfect, nobody can reject what you did, including yourself, except for we can't. And then we let ourselves down. And if nobody else is disappointed because they think we did a perfect job or better than anybody else, we know just what we didn't do. And if we worked for ourselves, we'd fire ourselves. And then the people pleaser, just trying to figure out, what do they want? Just tell me what your goals and desires are, or I'll figure them out for you and I will help you. You toss those wishes in the air, I will help you reach your wish. The thing is that we get really good at this to avoid RSD, but these aren't good. They're not sustainable. And the longer we do it, we're either going to get resentful. We're going to wonder, when is somebody going to want to know what our wishes are? We don't even know what they are. And then if we can't please the people, if we can't be perfect, then we are just going to avoid it. Why bother trying? It just feels safer. Drama slide. If we don't master it, we're always living in that constant feeling of reaction. And for me, I didn't want to stop my coping mechanisms, my people pleasing, because I was afraid that they wouldn't like me anymore. And the funny news is sometimes that's okay. Because if they really did, they wouldn't want you to hurt so badly. So I think this slide I call my hope slide. As I went through the different stages of grief after learning about RSD, of denial and, all the anger. It took a while before I got to acceptance, but each and every stage was important for me developmentally because I learned something through it. And where you are when you learn about it, you're just going to have a different process of dealing with RSD. But once you get a few years down and some of these new skills under your belt, then you can actually pull yourself out of the episode. And it is fascinating to be able to do that and not be in the grips of it anymore. It's once you get there, it's a common feeling and you can learn it. The medications help. They're like an emotional armor. And then in the middle of an episode, distractions, cognitive behavioral therapy, dialectical behavioral therapy. I've heard ACT is, which was a new one to me, acceptance commitment therapy. And mindfulness will help us focus our attention on our breathing so that we can make it through that episode. Off to Bill.
Thank you.
Since you mentioned dialectical behavioral therapy and CBT, we have a question in the chat around that. Does that help?
We have many questions about that. I've been watching as Beth and talking. Yes, they help a great deal. The example I give of just cognitive restructuring. When somebody says, I've been rejected, if they can substitute, I feel disappointed. Just a little bit of cognitive restructuring can help with a lot of the pain, put it more in perspective, and it's probably what really happened in the first place. So being able to not catastrophize, that's another cognitive theme, where everything on a scale of 1 to 10 is a 12. Being able to pull back from the catastrophe of having an RSD moment, episode, whatever. Also, it helps in preparation. Once a RSD episode starts, it has to run its course. It's going to run its course. So really the treatment, if you will, of RSD is prevention, prevention, prevention. And one of those things is to lead a life in balance. Not get already worn out emotionally. And that's what both cognitive behavioral therapy and dialectical behavioral therapy are excellent at. It makes us stronger people. It gives us those adult skills that we wish we had years ago. And it prepares us to be strong if and when an episode actually happens. So everything here you'll hear us talk about here has to be done in advance.
Any other questions? Yeah.
Can you advance?
There are some medication questions. I didn't feel like they fit yet.
The medication slides are coming.
It's coming. It's coming.
Why don't we just move on if you want, unless you've got some other questions.
I think that you answered the CBT DVD question, and I'm going to get out of your way. Oh, we did have a question around ACT, which I had looked up. Acceptance commitment therapy. Yeah. Acceptance commitment therapy. Is it effective? Is this another tool?
Again, it has to be anecdotal, but it hasn't been studied. But I know my patients who are well versed in ACT therapy say that they find it very helpful. I think really they came up with acceptance commitment therapy, ACT, just so they could have the acronym ACT. Because rather than sit there and suffer, most of the techniques in ACT therapy get you moving toward what matters in your life. And that's a great distraction when things are going badly. is to focus on things which really, really matter from those things that really, really don't. So yes, anecdotally, it works well. And what it hasn't been said yet, but so does mindfulness. Again, a good distraction from the pain that you're going through helps you out of it.
So there was one other question. I don't know if this is the right time for it, but I'm going to ask it, which is from a parent in the room. Their child has always had big emotions. Is there some way they can help them?
Oh, wow.
My
You have the rest of
13 year
the night?
My 13-year-old with ADHD has always had big reactions. As a parent, how can I help him through an episode?
Okay. That's too big for here. And we would not finish the presentation if I did anything meaningful with that.
Okay.
So I think
We
we
just
need to
know that.
move on.
Mhm.
Yeah. So can you advance
Is there, oh yeah, move on the next slide. And then is there a difference between RSD and BPD, or did you already cover that?
we have not covered that.
Okay.
And it's not part of the slides, but I can certainly cover it.
Okay.
Um, most docs have not heard about RSD. Yet most people with ADHD identify with it very strongly immediately as soon as they hear about it. It's that lived experience of having this happen over and over again, and knowing that other people who do not have ADHD don't experience it. It's important to note that the word dysphoria is literally Greek for unbearable. Sure, nobody likes being criticized, nobody likes being rejected, and stuff like that. But this isn't garden variety rejection. This is devastating emotional experiences that are extremely physically and emotionally painful. And once they've gotten started, we really don't have self-control over it. We feel very vulnerable to practically anything that's going to happen to us. So it's like everything in ADHD, it's an order of magnitude, of intensity. Everybody's forgetful. Everybody's lost their car keys. All 18 criteria of ADHD. But in order to get a diagnosis of ADHD, it has to be common. It has to happen every day. It has to happen everywhere. It has to happen your entire life. But as Beth pointed out, the most important thing is it has to be impairing. These are more than lovable little traits and quirks. They impair every aspect of your life as far back as your memory goes. Beth, could you advance the slide for me, please?
Sure.
Mood dysregulation. That is the hot topic in ADHD right now. In fact, in Europe, they have added a fourth core criteria called emotional dysregulation. For some reason, in the field of ADHD, we love these tongue-twisting names, when really, rather than saying dysregulation, we could merely just say loss of control. That's all it really means.